36 or go to helenfoundation.com.
My interest in cortisone continued because of its great efficacy. I asked the folks in medicine to give it to Helen, and they said no. We can't give it to her because her face will swell up. She'll gain weight, her skin will become thin, she'll get bleeding under the skin, her bones will weaken, and she'll get cataracts. Don't use cortisone for Helen. But cortisone remained the most promising medicine for her. I asked my professor colleagues to teach me more about cortisone. Well, they said it's produced by the adrenal glands of the body. There's 2 adrenal glands on top of each kidney. I said, you mean God put a poison into our body? 2 glands to make a poison to our body. But don't the billions of people on Earth have it in their body then? And they said, yes. Well, they don't have cortisone side effects. So I began smelling stinking thinking.
Cortisol plays a very important role in regulating the immune system. If we didn't have cortisol, then the immune system would get too activated, and not only would it destroy foreign bodies or viruses or bacteria that got into the body, it starts to destroy your own tissue. So we need cortisol to help regulate the immune system so it doesn't get out of control, and that's a major purpose of cortisol in the body.
My medical school colleagues explained that cortisone has to be in the blood at all times, day and night, to sustain life. If it drops to 0, death threatens through the disease we call Addison's disease. President Kennedy had Addison's disease. He remained alive and active by taking cortisone daily. When do we observe side effects? Well, let's suppose somebody comes in with arthritis. We give them cortisone at sufficient concentrations to get rid of their arthritis. Then we get the side effects. But as God puts it in the body, it doesn't have side effects. When people give it to people, we have side effects. Therefore, people don't know how to give it to people.
They check you over very thoroughly. He said it was the best physical he's ever had. They don't forget you. You're always can talk to someone concerning it. And that's what I liked about and you can always get them on the phone. Some doctors you can't ever get on the phone.
If you have arthritis or fibromyalgia and would like us to help you regain your quality of life without harmful drugs, call 888-2-HELEN. Counselors are standing by.
I go to the endocrinologist, and they teach me that hormones are regulators and have no side effects. I go to the pharmacology department. The professors there tell me that cortisone has side effects. But cortisone is a hormone. One must be telling a non-truth. So I concluded in the 1970s that cortisone doesn't have side effects, that people don't know how to give it to people. What we're observing as cortisone side effects is overdosing through lack of understanding. My medical school colleagues recommended that we study inflammation. Inflammation to a physician is heat, redness, swelling, and pain. To a scientist, it's leaky blood vessels in the area of inflammation. This picture illustrates the normal joint. It is fed by the bloodstream nearby. With each pump of the heart, blood goes by and nutrients flow slowly from the bloodstream into the joint to feed it, followed by a sewer system that lets off the excess. In a sense, the joint is alive. This picture illustrates the inflamed joint. The blood vessels are leaky in the area of the joint. With each pump of the heart, fluid from the blood, the plasma, enters into the joint faster than the sewer system can take off the excess fluid. The joint swells. The tension placed upon the joint is reflected in the pain that the person senses.
Well, I started in 2001, and I don't need to take anything for my arthritis and fibromyalgia anymore.
To learn more about the simple solution for arthritis and fibromyalgia, microdose therapy, call the Helen Foundation, located adjacent to Banner Baywood Heart Hospital in Mesa, for your free consultation. That phone number is 888-2-HELEN. That's 888-864-3536. Or go to helenfoundation.com.
So short-term inflammation is beneficial. What's the difference between the inflammation in short-term inflammation and the inflammation in arthritis? They reply, there is no difference. Then I asked, what is the gate between short-term beneficial inflammation and long-term destructive inflammation? They reply, we don't know. And I say, I think we better find out, because that's what's broken in Helen.
We can exercise and be more active.
If you want to use a walker, you can use a walker. But every time I see somebody use a walker, I think they ought to get acquainted with the Helen Foundation. Find out what this microdose can do for them. And the fact that we have taken friend after friend after friend out there, and they have used the therapy, and they're out of pain now, to me, is a miracle. And you think miracles happen nowadays? Yeah, they do.
The problem now becomes to define the gate that God put in the body to keep short-term beneficial inflammation from becoming long-term inflammation. I asked my medical colleagues, is there anything else in the body than cortisone that can arrest inflammation? And they say no. Well, that narrows down the possibilities. God must have used cortisone to be the gate somehow.
Microdose therapy is a breeze. It's very, very easy. You've got the book, you've got your charts, all the instructions, and then if you need any help, there's these people here at the clinic you just have to call, and they drop everything to talk to you and make sure that you're right on understanding exactly what you should be doing. That's what I've been impressed about, is all the people here. They really want you well. They just celebrate when you call in. When I call in my charts on the week that I can't come in, they're just thrilled. It's like they're my mother or something. It's a good feeling. They celebrate with us.
I would say this is about as close as you can come to a miracle, to having something in just a couple of months, to have arthritis pain virtually gone.
Logic. The gate must be a cortisone pulse. Let's go through the example of the child. The child falls, scrubs the forearm, gets inflammation. Within the week, the inflammation goes down, turns purple, and heals. Within that week, the child's body must have created a pulse of cortisone, sealed the leaks, the swelling goes away, and the pain goes away, and healing follows. Helen's body differs from the child's body in one respect. Her body responds the same to an injury. She will get inflammation. It will fight the infection. But her inflammation goes on because the pulse isn't big enough. The leaks aren't sealed. The swelling doesn't go away. The pain does not go away. And sometime, someplace, some physician will say, now arthritis has set in. The solution to Helen's arthritis becomes obvious with this picture. All Helen has to do is take cortisone tablets that are available to all, take them at a special time, build the pulse back to its original size, then the leaks are sealed, the swelling goes away, and the pain goes away. Microdose therapy is the simple solution to arthritis.
The most important thing, I would check with someone that has taken it, that has experienced this. This one lady that he checked with, she loves to go dancing, and she couldn't go dancing. And so after she started taking this, she started getting better. And she couldn't believe it, that she could go dancing.
She was dancing every week now.
I think Dr. Stenberg's work is exceptionally important, and I think the way that he's doing it is the correct way to do it. That is by educating people about their own health and how to take care of it, how to tune into their bodies and be able to evaluate their pain and then be able to take small doses or microdoses of cortisol only when their pain exceeds certain levels. That way they can keep their levels of cortisol to the normal